Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC and Director of Communications and MC here at Gold Learning. Today, we're talking about our Gold Midwifery online conference coming up very soon here, 2026. I'm very excited. You can head over to the website right now if you're ready. If you're ready to jump in and see all that's happening, please go over to goldmidwifery.com and check out all the details, including with Nell Tharpe. That's right. She's back with us this year. I'm so excited to have you here, Nell, talking about clinical competencies for assessment and repair of birth-related tissue trauma. Welcome back. It's great to see you, Nell.
I'm delighted to be here, Fiona.
Well, that's wonderful. And I know a lot of people know you for, repair of birth-related tissue and trauma, but you are diving into those clinical competencies. We're so excited. I know you have a lot to say about that. And I know you've been teaching suturing and perinatal repair for decades, right? We won't say the number. You can say the number if you want. But really tell me what first led you to focus on competencies as a way of support learning and confidence in these essential midwifery skills?
So it's a great question, and I really appreciate it. I have been teaching suturing since 1994, and over the years, I always ask people what they want to get out of each session. And certain themes kept cropping up. And as I refined my teaching, I realized that I need other people to be able to teach specific skills. And that
Mm.
made me think about, well, what skills and how do they move in a logical sequence from novice forward? And that's how the competency started.
That's, I mean, it's sort of obvious when you think about it, but brilliant, in terms of putting the competencies together. So many clinicians really learn suturing, I feel like in fragmented or inconsistent ways. And I know you can speak more to this, of course, but from your perspective, where do learners most struggle when it comes to assessment and repair of birth-related tissue trauma?
I think there's three places where people struggle. One is they struggle when they are a novice in just getting the big picture.
Hmm.
So trying to make sense of everything, it's too much information often without enough context. But when we're talking about assessment and repair, a lot of people do not do a methodical assessment. And that methodical assessment where you actually know what you're looking at, why you're looking, what you're seeing, and how the tissue has come apart, and you need to know what it looks like and what the landmarks are before a tear to understand
Hmm.
how you're going to put it back together. And then the last piece is the art of wound closure. And in the old days when everybody had episiotomies, and these are the old days, but that's when I
Sure.
trained, you had a straight incision. So it's easy to
Mm.
put together, but this is like a jigsaw puzzle. So you have to activate your creative, intuitive mind as well as your analytical mind and have the two merge together to be able to have a functional, anatomically correct, and cosmetically beautiful repair.
Wow. That just threw up a couple of things for me when you said, like, really, this is an art. It's not a straight line. We all know and still see episiotomies, unfortunately. But yes, I mean, this is an art that can only be over time. I'm assuming that this is something that you would learn. So is this it, now when you're looking, you said that you need to essentially, it sounded like you need to slow down, look at it, map it out, all those types of things. Is time the problem? What is it that is not allowing us to really flourish in this area and look at it as art and understanding that this is going to take an additional amount of time, clearly, and making sure that we have all the tools and everything. What is the gap that's there?
So it's an enormous question that you just asked. It depends on where you train. Uh,
Right.
if you are focused on how you handle your instruments, how you manage
Hmm.
your needle, how you manage your suture, your attention is not on the tear itself or the
Right.
repair. So that's point one. The
Hmm.
second is some people are very visual and other people are not. And so trying to figure
Right.
out what goes where
Mm-hmm.
takes time and practice and repetition and guidance.
Mm-hmm.
And if people train with someone who says, you put a stitch here, you put a stitch there,
Mm-hmm.
then they might have a concept of where to put the stitches, but not how the tissue actually goes together. And
Right.
so if someone can actually say, the reason you put a stitch here is so that see this and this come together and see how
Mm-hmm.
now, let's use this for an example, we've restored the hymen. And the hymen is now making a full circle around the
Mm-hmm.
vagina. And that anatomical piece of it is critical. It's not just closing the wound. It is restoring the anatomy. And it'll never be like it was pre-birth,
Right.
but it should still be functional and it should be anatomically correct. And
Mm.
and that anatomic correctness is important. There has been an attitude that if you put two pieces of vagina together in the same room, that they'll heal. But
Right.
that doesn't mean they'll heal well or that people won't have problems afterwards. And
Mm.
if we are committed to birth equity and having the best outcomes for every single birthing person, we have to, as midwives, raise our level of competence for both doing an assessment, so we're making an accurate diagnosis, and
Mm-hmm.
then actually applying the correct or optimal techniques for doing the repair so that we get the best possible outcome.
Mm. Yeah, and I can hear big question, because I it's a multi-layered, many aspects. It starts from the very beginning, but there's also many people in practice today. Your work really just emphasizes that competencies are a continuum rather than that checklist, as you mentioned. How can competency-based framework support both skill development and then long-term refinement, which I think is what you're hoping to see in practice, right?
Yes. So, it'll take between 5 and 7 years of practice before people become really proficient. And that's provided they become lifelong learners, that they
Mm-hmm.
do see this as a continuum, so that they
Mm-hmm.
use the competencies as a framework to build a really strong foundation, first of all, and
Mm-hmm.
then they begin to refine. And I'll use hand ties as an example. Most right hand dominant people will tie with their right hand.
Sure.
But as they move forward in their careers, they might opt to tie with their left hand so they never have to put their needle holder down. And
Mm.
those small efficiencies make the repair faster. The more you understand the three-dimensional anatomy, the more accurate you can place your stitch, and then you're going to have fewer stitches.
Mm.
Um, and so getting faster is not related to hurrying. It is to being efficient. This is the one place in midwifery that I think efficiency is important because efficiency,
Right.
the definition I'm using, is that you are eliminating every unnecessary step.
Mm-hmm.
And when you watch someone who is very experienced and they make suturing look so easy, it's
Right.
because they understand the technical skills, they understand the anatomy, they
Mm-hmm.
understand the laceration, and they can apply all of it simultaneously to
Gotcha.
quickly perform a repair. But we don't
Mm.
start there. That's
Right.
our end goal, and we have to see this as a continuum and build practice into our practice.
Mm. I love that. Yeah, it's going to take some time. And I think reevaluating how we're learning as well. Like you said, it is going to be different for everyone. We know that, but understanding this type of skill is also going to have aspects where we need to look at different elements as well. You mentioned equity. I want to talk just briefly about this. When you think about birth equity and optimal healing, what do you hope that participants will take away about the role of competent assessment and repair and restoring function, and really the confidence for birthing people because this matters to them as or should matter to them as well. And I think sometimes they don't know, what's happening, but we want them to participate in this as well, understanding their bodies and their anatomies, right?
So I think that is so important. I think that every birth attendant, no matter what their credentials are, should be able to talk knowledgeably about a laceration and explain what its long and short-term ramifications are to any individual
Mm,
birthing person. So part of shared decision making is saying, this is what that impact might be. And we've all met people who say, well, I don't want stitches. I just want to
right.
heal. And
Yeah.
and to be able to say the level of laceration that you have has interrupted the muscles, so you won't be able to squeeze your vagina anymore if we don't do the repair. Is that
Hmm.
what you want? And to put it in concrete terms that the client actually understands. And
Right.
if they were like, oh, no, I don't just want my vagina gaping open.
Right.
I want to be able to wink it. I want to get the maximum pleasure out of sexual whatever I like.
Yeah.
Um, then this is an important piece because
Hmm.
the pelvic floor muscles that are affected by lacerations, they impact elimination, they impact sexual function, they impact our balance. So how we walk, how we stand, how we sit, how we squat,
Hmm.
all of these things are involved. And
Yeah.
if we don't engage with our clients about those important aspects, we are not providing them the information to make an informed decision. And they can make a decision different than what we would recommend,
Sure.
but
Yeah.
we should be willing to make a recommendation based on the clinical findings and then have a discussion about what we're going to
Mm.
do from there.
Yeah, absolutely. Well, thank you, Nell. I mean, that takes it right back into the real world and the impact of skilled care, which is what I know you're going to be talking about. So thank you so much for that. Again, with Nell Tharpe, going to be talking about clinical competencies for assessment and repair of birth-related tissue trauma. Now, it's been a delight having you here. Thank you so much once again for joining us as part of our midwifery event.
Always glad to work with you, Fiona, and I'm so happy to be here at Gold.
Yeah, absolutely. And for all of you again who tuned in today, thank you so much. If you have questions for our team or for Nell, well, of course, come and join us on the day. Nell Tharpe is going to be with us live over on goldmidwifery.com. You can check out all the details and the time zone that it's going to be in for you. So you can come and join us. It's going to be a wonderful opportunity for you to sit down with the experts here at Gold Midwifery and get all your questions answered. Thank you again to you, Nell, for being with us here today. And we'll look forward to seeing everyone very soon. Bye bye for now, everyone.